Good afternoon, everyone, and good evening or good morning to those overseas that are in attendance today. Today, I'm going to provide an overview of where we are as a company, how we performed in fiscal year 2025, provide some guidance on what fiscal year 2026 and beyond will look like for PeptiDream. After this, Kia will provide an overview of our financial results for the 2025 fiscal year, along with guidance for the fiscal year 2026, before we move on to take questions from those in attendance. PeptiDream was founded with the dream of creating a revolutionary peptide library generation and hit finding platform that could enable us to unlock the exceptional promise and power of macrocyclic peptides to create the next generation of life-changing therapeutics for patients in need worldwide. What was only a dream 20 years ago has now become a reality. PeptiDream started as a university spin-out, focused on creating our revolutionary PDPS platform and getting some of the world's largest pharmaceutical companies excited about the power of macrocyclic peptides. We spent the next 10 years focused on our discovery and development partnerships, narrowing our own focus to our 5 core therapeutic areas across RI and non-RI, creating our own internal wholly owned discovery pipeline, and acquiring the exceptional radiopharmaceutical business now known as PDR-Radiopharma to further accelerate all of these efforts. Today, PeptiDream, on the back of an exceptional 2025, embarks on a new chapter in our history, with our first wholly owned CA9 program moving into a US phase 1 study in the coming weeks. This event marks the start of our evolution from a global discovery company into a truly global discovery and development company, and represents the next phase toward our goal of ultimately becoming a global pharmaceutical company. Over the coming years, investors should expect to see us continue to focus on our discovery partnerships as we see the fruits of those efforts produce clinical compounds and clinical candidates that move into clinical development. In parallel to these efforts, across our 5 core therapeutic areas, we will continue to grow a robust preclinical pipeline, both in-house and partnered, while in parallel moving some of the highest value programs into clinical development to both unlock further value and operational flexibility, with the ultimate goal of creating exceptional value for shareholders and delivering life-changing therapeutics and diagnostic to patients. Our focus has been and will continue to be on creating a pipeline of high-value preclinical and clinical programs, both in partnerships and as in-house wholly owned programs across our 5 core therapeutic areas. The 5 core therapeutic areas represent initially in the RI side of our business, RI PDCs. We have the goal of to continue to position PDR-Radiopharma as the leading radiopharmaceutical company in Japan by supplying a robust set of exciting programs for PDR-Radiopharma to bring to patients in need in Japan. PeptiDream also has a validated platform and track record of discovering best-in-class and first-in-class macrocyclic peptide ligands for use as targeted RI conjugates across a broad spectrum of targets and tumor types. And this is highlighted, as I'll highlight, via our Glypican-3 program and our FAP program moving into the clinic in 2025. Our second core area of focus is around oral and injectable peptide therapeutics. We have a long collaboration history in the field of injectable peptide and oral peptide therapeutics, and we've been leveraging this extensive experience and expertise to in parallel develop a robust internal pipeline of programs. The third core area is around oligo-PDCs. PeptiDream has been researching utilizing macrocyclic peptides as targeted delivery vectors for CNS delivery back since 2017, and also ex-liver oligo delivery since 2021 across a wide range of partnerships. We have extensive experience in conjugating various partners' oligotherapeutic payloads to our peptides and showing robust delivery, and I'll touch on that today. Our fourth core area of focus is around cytotox PDCs. From our RI business, we have a growing track record of discovering and developing tumor-targeting macrocyclic peptides, utilizing RI payloads for cell killing. In this area, we extend beyond RI to also cytotoxic payloads and other small molecule payloads capable of killing cells, similar to ADCs. In most of this business, the cytotoxic payloads are provided by the partner, but we have an extensive growing pipeline in this area. And lastly, is around our area of multifunctional peptide conjugates. PeptiDream has been combining our macrocyclic peptide discovery capabilities with our next generation proprietary linker architectures to allow us to create an entire new spectrum of multi-specific biologics that are capable of doing some exceptional things as both therapeutics and potentially as next generation diagnostics. We made exceptional progress across these efforts in 2025. We had 6 programs enter clinical development in total last year, allowing us to close 2025 with a total of 13 programs in clinical development. This is an exceptional year for us, almost doubling the number of clinical programs that we have for this company. In addition to that, beyond just the 6 programs that moved into clinical development, we saw 13 programs stage advance across the entirety of our development pipeline and portfolio in 2025. We saw our ALXN2420, our GHR antagonist program, partnered with Alexion AstraZeneca, moving into a global phase 2. We also saw a number of new programs in our cadherin-3 program and our IL-17 oral program also being announced. So 2025 represented a significant and exciting new phase driven by the creation of significant pipeline value, both with preclinical programs and the successful movement of clinical programs for us. More specifically, on slide 9, we highlight some of the late-stage development pipeline that is progressing forward at PDR-Radiopharma. We're on target to bring these 3 late-stage exciting programs to the market between 2027 and 2029. We've announced previously on the right the LinkMed collaboration for the copper-64 ATSM. This continues to progress in an exciting phase 3 study in malignant brain tumor patients, on path for the submission of an NDA in 2027. The 2 PSMA programs partnered with Curium, our diagnostic copper-64 PSMA INT, entered first patients last year and is on path to progress forward toward NDA submission in 2027 for the diagnostic of prostate cancer. Fast followed by the 177 lutetium PSMA INT therapeutic program, which has now kicked off its registrational bridging study, utilizing the data from Curium's global phase 3, and are now on path toward potential submission in 2029. So these are 3 late-stage exciting programs that should contribute significantly to the growing revenue at PDR-Radiopharma. In addition to those assets, in 2025, we saw our in-house or partnered discovery assets also moving forward into the clinic. With RayzeBio, our diagnostic and therapeutic pair of gallium-68 glypican-3 and actinium-225 glypican-3 as the therapeutic, moving into a phase 1, phase B study for the treatment of hepatocellular carcinoma, liver cancer. Excitingly, that was also followed by the lutetium-177 therapeutic and diagnostic gallium-68 FAT program, partnering with Novartis, that Novartis took into a phase 1 study against 4 different types of cancers of solid tumors. We're looking forward to the future phase 1 results to arise from those programs, although we simply would note that, of course, those programs are being run by Novartis and Raise Bio BMS respectively, and therefore they are in control of the disclosure of the phase 1 clinical results. In addition to excitement around the late-stage assets and our partnered programs that have been discovered at PeptiDream, as I mentioned, we're also developing a robust internally wholly owned pipeline, centered around initially our internal CA9 program. At the end of 2025, we had filed INDs for both the diagnostic copper-64 CA9 program and the therapeutic actinium-225 program, both of which were accepted. And now we are on path to initiate the phase 1 study of both of these programs here in 2026. As a second program that we had announced 2 years ago, 18.2 for gastric cancer and pancreatic cancer with the diagnostic copper-64 agent in partnership with the actinium-225 therapeutic. We are on now path in 2026 to initiate a phase 0 study to get an initial early look at human feasibility data in patients. In addition, we are rapidly planning a phase 1 study that hopefully we will have more news on soon. Looking forward possibly to start the initiation of the phase 1 in the second half of 2026. The third program, which we had announced at our R&D Day, December of 2025, was targeting cadherin-3 for potential use in head and neck, squamous cell carcinoma, and triple-negative breast, and a few other types of solid tumors are possible. We think this is an exciting program. We currently have moved this into IND-enabling studies, and we are also now rapidly investigating the possibility of conducting a phase 1 human validation study as soon as possible for this program. We look forward, of course, over the course of 2026 to update on the progress of all 3 of these exceptional programs here at PeptiDream. From the previous 3 slides, you can see we're developing a compelling targeted radiopharmaceutical pipeline, both of exciting therapeutics and next-generation diagnostics. And we couldn't do any of this without PDR-Radiopharma. PDR-Radiopharma is Japan's leader in radiopharmaceuticals. It has a 50-year history from 1968. It represents the clinical and commercial arm for PeptiDream in Japan. It has a fully integrated R&D, manufacturing and commercialized operations, and a nationwide distribution and sales network. And the 450 plus people at PDR-Radiopharma represent a trusted partner for global companies to access the Japan market. The ongoing transformation of PDR-Radiopharma that was initiated when we acquired the company in 2022 continues today under the exceptional leadership of Murakami Masato. We are very much focused on strengthening our teams across the entirety of the organization, focused on our people. We are focused on driving capacity, as we had mentioned previously, and I will touch on in a later slide, expanding our manufacturing capability and capacity and related infrastructure is a key to the growth of this business. And lastly, diversifying the product portfolio, not just across SPECT and PET and targeted therapeutics, but also from a partnering perspective, from retaining rights to the Japan rights to certain PeptiDream collaboration programs, such as glypican-3, and also PeptiDream's own wholly owned compelling programs to take forward. We believe PDR-Radiopharma is well positioned to see exceptional revenue growth in the many years to come. And we look forward to seeing these unfold. Beyond our radiopharmaceutical business, the other 5 core areas of focus are, of course, spread across our non-radiopharmaceutical business. The second core area of focus that I'll mention today, of course, is around our oral injectable peptide therapeutics. PeptiDream has numerous collaboration programs in the field of injectable and oral peptide therapeutics, and we have been leveraging this extensive experience and expertise gained over the past 10 years. At the close of 2025, PeptiDream currently has 5 programs in clinical development, but we have a robust pipeline of preclinical collaboration programs complemented by a growing number of high-value in-house programs that are setting up us for future success and future growth. In 2025, we saw significant progress across these efforts, highlighted in part by the LXN2420 program. As I mentioned, this moving into phase 2, a global phase 2 study, is a big step forward in seeing our pipeline and our discovered macrocyclic peptide programs progressing toward the market. In addition to that, we had 2 other programs, one partnered with Asahi Kasei Pharma and one partnered with Johnson & Johnson, that also reached development candidate nomination in 2025. Both of those programs, which have certain information yet to be disclosed, are progressing toward the next steps of phase 1 initiations. We look forward to seeing these programs advance in that respect. Complementing our clinical pipeline, of course, has been our in-house preclinical discovery efforts, highlighted in part by our oral myostatin inhibitor program, which we have reached development candidate nomination of, and we continue to progress with IND-enabling efforts as we continue partnering activities around this program. As everyone is aware, we did not find the right partner or have yet to consummate a deal for this program, but we've had a number of exciting discussions, and we look forward to those continuing here in 2026 to find the ideal partner for this exciting program. At the end of 2025, we also announced our oral IL-17 dual AF inhibitor program. This exciting program has now progressed to development candidate nomination and will be progressing into IND-enabling studies while we consider partnering activities. There's exceptional interest around this program. We continue to field such interest, and we will continue to listen and consider best partnering possibilities for this program while we continue to drive this toward clinical development. In addition to both the oral myostatin inhibitor program and the oral IL-17 AF inhibitor program, we have a number of other exciting preclinical oral peptide therapeutic programs ongoing that we look forward to taking forward toward development candidate nomination in 2026. And once we do, we will, of course, make that news publicly available. From our third core area of focus is our peptide oligo conjugate efforts. We have a strong roster of peptide oligonucleotide conjugate discovery collaboration partners, from Alnylam to Takeda to Shionogi and so forth. Extensive experience in conjugating partner therapeutic oligo payloads to our peptide delivery vectors has gone exceptionally well. We're going after not only targeting CNS, but also the liver organs of skeletal muscle, cardiac muscle, kidney, and adipocytes. As a highlight of 2025 in December, we announced a pivotal breakthrough in our collaboration with Alnylam, demonstrating extrahepatic tissue-specific delivery of a peptide oligoconjugate in large animals. This breakthrough paves the path for us to see multiple programs, both nominated as development candidates, and we expect to see these programs progress into the clinical development in the years to come. This represents an exceptional and transformational time for our peptide oligoconjugate efforts. Our fourth core area of focus is around peptide cytotoxic conjugates. As I had mentioned, we have a track record of discovery and development of tumor-targeting macrocyclic peptides capable of delivering both RI and cell-killing payloads, yielding similar potencies to comparable ADCs. These exceptional efforts have gone and continued extremely well in 2025, and we are now progressing toward the nomination here in 26, potentially of the first development candidates to take forward into clinical development. This fourth area for us, we believe, is going to continue to grow in the future and yield many development candidates in clinical programs in the years to come. Lastly, is around our multifunctional peptide conjugate programs, largely focused around next-generation immune engagers. We have been combining PeptiDrive's macrocyclic peptide discovery capabilities with our next-generation proprietary linker architectures to create an entire new spectrum of multi-specific biologics that demonstrate all of the best qualities and best properties of their more complex protein brothers, but with the simplicity of the ease of chemistry of peptide-based therapeutics. In 2025, we had successful in vivo proof of concept of our first in-house immune engagers, which is supporting expansion of our efforts and expansion of the programs. And at the same time, we are both considering strategic partnering of these programs and a variety of different collaboration opportunities in the MPC space. Everyone should look forward to more news to come around this area for us in 2026. As we look toward guidance of 2026 and around our clinical pipeline, I am very excited to announce that we expect to see anywhere from 6 to 12 programs enter clinical development in 2026. While we haven't broken down whether these are RI or non-RI at the moment, we expect to see these programs, as they advance into clinical development, allow us to close the 2026 year with anywhere from 19 to 25 clinical programs. These 6 programs in this ratio that may not that may enter the clinic in 2026. If they don't, they will be on Q4, and then they will progress in the clinic in 2027. So we see very good line of sight to these 12 programs advancing. We're extremely excited about both 2026 and also 2027, and seeing our clinical pipeline continue the trend we saw in 2025 and expand further. These amazing efforts underlie our transformation into a discovery and development company. To enable this next phase of growth, the next 10 years of this company, we felt it's extremely important to create a new organizational structure and management system to enable this to occur. As announced in part last year, we have now created both an executive leadership team and also a research leadership team and a development leadership team to coordinate our research-related functions and our development-related functions, and for the ELT to oversee the entire strategy of the company and all aspects thereof. To support this organizational change, we also feel it's extremely important to increase the management team. PeptiDream has relied on a very skilled but lean management team until now. To recognize the future of this company, we believe it's important to expand that team further. This is in part why we are introducing an EVP, SVP, and VP system. We expect going forward to add additional EVPs, SVPs, and VPs in the future. This, as is depicted on slide 20, is not going to happen tomorrow. This is over the next 5-10 years of our company to build out this management structure so that we can take on the future of developing a robust clinical pipeline and also advancing the many, many preclinical programs we have here at PeptiDream. To support this further, of course, is our continued investment in growing the company from a capital perspective. As we have touched on in the past, what is shown here on slide 21 is our efforts to build and expand PeptiDream's current headquarters and R&D center at the Tonomachi site. We believe this program is moving very well through the design phases. We had hoped that this would start construction in late 26, but that has now moved into early 2027. We're very excited about the capabilities that this new building will bring to us going forward. In addition to that, on the right side is the Kazusa manufacturing site, a further extension of PDR's current manufacturing capabilities by adding exceptional new lines to support our next generation programs and products, both across partners and in-house, supporting the lutetium-177, actinium-225, and copper-64 related programs. This is on track to initiate construction in late 2026 and become operational sometime in 2028. So we very much look forward to providing additional news on both of these exciting capital projects as they advance here in 2026. And with that, I would like to pass this over to Hio Kaneshiro to continue the financial presentation.
取締役の金城でございます。少し時間もしておりますので、私の方からポイントを絞る形で、2025年度の連結決算業績と26年度の見通しについてご説明を申し上げたいと思います。まず、最初に23ページでございますが、2025年12月期の連結での業績概要を示しをしております。創薬開発事業におきましては、経口のマイオシタチン阻害剤、こちらの導出につきまして、2025年度中の締結に至らなかったことから、気象予想に対して大幅に未達の結果となりました。一方、放射性医薬品事業におきましては、成長ステージに入りつつあるペット事業、これがしっかりと牽引をする形で、2022年に経営統合して以来、4期連続での黒字を維持するとともに、臨床パイプラインの進捗を含めて、着々と成長を積み重ねてきております。続いて24ページにおきましては、期初の業績予想からの差分をお示しをしております。まず自社品であります、経口のマイオシタチン阻害剤の導出につきまして、アセット価値を最大化していくということにおいて、最適なパートナーとの提携が必要不可欠であるという考え方に基づいて、こちらを優先する形で、2025年中の締結には至らず、26年にかけて提携交渉を継続をしている状況でございます。また、25年度中に予定をしておりました既存のプログラムの開発マイルストーン、並びに新規提携、この締結時期が一部26年度に期ずれする結果となっております。 続いて25ページは、2025年度の連結バランスシートをお示しをしております。見ていただいた通りでございますが、ここ数年来、財務の健全性についての取り組みを着々と重ねてきております。自己資本比率の着実な改善、並びにネットキャッシュポジティブの維持を継続している状況にございます。2026年度以降につきましても、将来の成長に向けた積極的な投資を継続していく予定ではございますが、財務の健全性、引き続き非常に盤石な状況でございまして、現時点におきまして、エクイティファイナンスの予定はございません。続いて26ページは、25年度の連結のキャッシュフローをお示しをしております。棒グラフ、右側のところでございますが、25年12月末時点において、現金としては約286億円という状況になっております。でそれぞれ各営業キャッシュフロー、投資キャッシュフロー、財務キャッシュフローでございますが、昨年度の当期純損失以外のところで申し上げますと、法人税等の支払い、また借入金の返済等が主たるところを占めておりますとともに、ペプチドリーム並びに PDR ファーマの研究並びに製造に関連する機器、将来の成長に向けた設備投資が主なキャッシュの減少要因となってございます。続いて27ページは、2026年12月期の連結の業績予想を示しをしております。売上収益といたしまして、320億円プラス同室一時金という形で発表させていただきます。昨年と同様のことを繰り返さないよう、大型案件となる可能性のある同室一時金につきましては、あえて切り分けをした上で、複数の種まき案件、これらをしっかりと積み上げていくことによる安定収益、またアセット価値を十分に最大化していく、この前提においてのアップサイド、これらを戦略的に高いレベルで両立していきたいと、そのように考えてございます。続いて28ページにおいては、当社グループにおける今後の成長ドライバーと中長期目標をお示しをしております。先ほど来、社長からもご説明ございましたが、グローバル創薬開発企業として5つのコア領域、そこにおいてアセット価値をしっかりと積み上げていくこと、これが当社グループにとって重要な成長ドライバーとなることはもちろんでございますが、1つ目にプラットフォームによる安定したキャッシュフローの創出、2つ目に5つのコア領域において戦略的に積み上げるパイプラインの資産価値、また3つ目としてインフラの強みを融合した独自の競合優位性、どれか一つを有するバイオテック企業は世の中にもございますが、これらを併せ持っていることというのは非常にユニーク。当社グループにおいて独自性の高い成長モデルの基盤となっていること、この点を改めてお伝えをさせていただければと思います。最後になりますけれども、サステナビリティに関する取り組みをお示しをしております。ご覧のいただいた通りですが、できるところからたゆまず継続的に取り組みを積み重ねてきております。その結果として、右側でございますけれども、各評価機関からのレーティングにおきましても、右肩上がり、このトレンドをしっかりと維持をし、現在業界内におきましても、かなり高い水準にまで積み上がりつつあるものと認識をしております。これまで密に連携をさせてきていただいている各ステークホルダーの皆様方、この場を借りて改めて感謝申し上げたいと思います。以上、私からのご説明とさせていただきまして、この後皆様からの質疑応答に対応させていただければと考えております。